what the research has shown is that it's red, a certain range of red, and certain range of near infrared that can drive this beautiful energy into the person's body. That's what we do. We magnify it many times and drive that into the body. And that's why when a person gets out of these beds, and again, as I said, it's about bathing the whole body at the same time with this glorious energy and bringing the mitochondria back to normal. And that's why it works on anything and everything in the body, because your body is made up of tissue, and every tissue is made up of cells, and every cell has mitochondria in it. And if we can stimulate the mitochondria to come back to normal, then we can have phenomenal success.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who's out there helping us humans to explore, expand, and explode.
Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Dr. Carl Rothschild, and we're going to be talking about red light therapy. Carl is the founder, researcher, and owner of Trifecta Light Technologies, Incorporated, which is an industry leader in the LED, infrared, red light, therapeutic, healing light lamp modality. That's a lot of words. Carl has been at the forefront of red light therapy here in the United States since 1979. He is also a chiropractor. Carl's going to be talking about what red light therapy actually is, the science-backed benefits of red light therapy, how red light therapy works, and how it affects the mitochondria in our cells. Also, red light therapy versus near-infrared light, how to use red light therapy for the best results, and who can benefit from red light therapy. So let's jump into this. This is Carl Rothschild.
So a little bit about myself. I started in 1975 as a chiropractic student when I was a bit of a hippie with my hair down to here. And my goal was to help people. And as corny as that sounds, I don't mind making money, but I still to this day, I really get a kick out of assisting people as much as I possibly can. So I was 40, so it's been 46, 47 years as a chiropractor. And about 26 years ago, I was introduced to red light therapy when it really first came to the United States. First gentleman that was telling me about it was an orthopedic surgeon and professor out of USC out here in California. He brought the technology essentially to the United States. And as such, he was involved with, well, let's just put it this way. He told me, shine a light on somebody and it's going to make a difference. And at that time, I was in practice for about 20 years and I figured I knew everything and I couldn't believe that this was true, but it absolutely revolutionized my practice. And that's with equipment that was a fraction of the power of what we currently are using now. But even so, it was a state of the art at that time. And this lady would say, I have gum disease. You think you can help me? Now, at that time, all we knew for sure is that we couldn't hurt somebody. We didn't know if we could help them, but we knew we couldn't hurt them. And I helped her gum disease. And then this other person comes over to me and says, you did such a great job on my brother's shoulder. Can you help me with my kidney problems? We did. And it just kept on going like that over the years and years of the technology getting stronger, getting better. But then something interesting happened about 13 years ago. There was a discovery that there was an element of a wavelength in light that I was not using that was red light only. Now, up until that point, all I used was near infrared. And in my discussions, I'll talk the difference between red, near infrared, and what you were talking about, which was far infrared. When you go to a sauna, when you go to the yoga, hot yoga, that's far infrared. And far infrared, which chiropractors use, is a fancy way of getting deep penetrating heat, nothing more. We're not going to make any long-term changes, but it was very good for a chiropractor to get the person relaxed before, if I'm going to be doing any manipulation or anything like that. About 13 years ago, using red light only, there was a company that discovered that there was an element of just red light that could absolutely help in weight loss. And that definitely piqued my interest because, again, I never used red light because we knew that red light wasn't nearly as healing, but wow, it could help with weight loss. And so right from that point, around that time, a team and myself, we got involved with manufacturing equipment because I wanted to get even more involved. I know how important weight loss is to people. And as a chiropractor, I don't believe in putting anything in the body that doesn't belong there or yanking anything out. We don't want to freeze the fat. We want to boil the fat. We don't want to laser the fat. We don't want to radio frequency or ultrasonic cavitation the fat, destroying fat cells. That's not what a chiropractor typically is about. We're about natural healing. We're about not injuring or damaging anything and not putting anything in the body, again, or taking anything out. But it was found that this red light could help with fat loss. And to be honest with you, at that time, they didn't know why it worked, but it did. And it works. And so that piqued my interest enough to get to the next phase. So we were manufacturing at that time, involved with lasers and pads and involved even with panels on the wall and things like that. And we had nice results. We did. But then something else happened about several years ago called COVID. And our practitioners wanted less physical contact between the patient and the provider. And we came up with the bed. So with the bed, you don't need staff. You don't have to spend money on hiring somebody. The person can get in and out of bed themselves. Very simple. They press power on because the settings are very simple and that's already been preset. So they get in the bed, they get out of the bed. Thank you very much. And they leave, more or less. And that's why we created the bed. And what we now since had learned within actually the first month, and this was years ago, of us delivering the first series of beds, what we learned back then, that people actually started experiencing things we did not anticipate. So for example, we had a gentleman who was having heart attacks once, if not twice a week. And this had been going on for 12 years. Had you ever heard of such a thing?
Yeah, I thought you would just be dead if that was happening.
I had never heard of such a thing. And so what they had done 12, 13 years ago is they implanted a defibrillator into his chest. So every time he died, it would zap him back to life. And this happened hundreds of times. So by the time we met him, he was on his deathbed. I mean, his energy was gone, every organ gland. I can't believe they didn't have him on a transplant list and get, a new heart because it was not working. And so the provider called me up and said, should I even treat him? I mean, I don't want him having a heart attack in my office. And I said, just treat him for 5 minutes and stay in the room the whole time. And that patient went home that night. And that was almost 2 years ago. Hasn't had a heart attack since. He's had more treatment, but has not had a heart attack since. And everything has come back to life. Everything. Every organ, every gland. His erectile dysfunction is gone. His blood pressure is normal. His energy, as he described it, is through the roof. He was talking about being at church, and people would come up to him and they go, wow, you look so different. And one lady said, you have found life again. And he went and he goes, yep, red light therapy. And, did I anticipate this? Not really. We'd hoped we could help in some way, but we weren't sure to what extent. And this is happening a lot with different symptoms, different conditions, but we're hearing this a lot. And what we have since learned is that when you bathe the whole body at the same time, front and back, top and bottom, left and right, inside and out, when you bathe the whole body at the same time, that's when you're seeing, and we're seeing, these miracles. I know it's not a scientific term, but it's the best way I can describe of these types of amazing results. happen when you bathe the whole body. You know, people ask me about putting a mask on their face or lasers and stuff. They're fine. They're fine. They're good. Chiropractors love toys. I've had many, in quotes, good things in my practice, whether it's a hyperbaric chamber or PEMF, all these different things. They were good. But in retrospect, they were just good. And what we now see is unbelievable. Unbelievable. So we have a lady that wrote me a letter, email, and she was describing how Lyme disease had basically destroyed her life. The word she used was ravaged. It ravaged her entire body. All these organs, all these glands, all these things were being destroyed by this Lyme disease. And she started using red light therapy, and it changed everything for her. She came back to normal. So when I had to call her up, find out what was going on, and so that's when I learned it wasn't just Lyme. She had 16 serious conditions, including 20 years of constant diarrhea, including shingles and, yes, Lyme disease. She also had 3 forms of psoriasis. She had all kinds of eye issues, thyroid issues, liver issues, kidney issues. She had from migraines that were devastating to her. So they had put her on a drug that has since been taken off the market that destroyed her kidneys. And she wound up with having, I'm sure maybe you've heard of somebody who's had a kidney stone and how painful that is. And she's had hundreds of kidney stones because of that drug that she was taking for the migraines. Well, we can't stop the stones from happening. But what she did find out is that by using the red light therapy, it doesn't hurt anymore. And she can pass that stone in a few hours instead of waiting days for that to happen. But getting back to her 3 forms of psoriasis, she had goutate psoriasis, plaque psoriasis, and psoriatic arthritis. The psoriatic arthritis was horrible. And she also wound up, because of that, with a thing called dactylitis. And dactylitis, they call it sausage toes, where she would wake up in the morning and her toes were terribly swollen and black and blue and painful as heck. And after 2 visits, that stopped. 2 treatments. After a series of treatments, all the other stuff that went on, all the psoriasis, she had bleeding. Her ears were constantly bleeding. She had a rash across her forehead, down both arms and legs. They're all gone, all stopped. So again, did I expect this? We put this out there knowing that the worst that'll happen is nothing. It has, in the 50 years this technology has been studied, there's never been a recorded side effect. You couldn't hurt somebody with this stuff if you tried. I love it. I mean, can you imagine having something that at the worst that'll happen is nothing, and that's pretty rare that nothing happens. I tell everybody, listen, just try it for 6 visits. And even though often we'll see changes in just 1 visit, but if you have a condition that's, significant, go 6 visits and see if you don't see a change. Now, each visit is 12 minutes, and we're talking about 3 times a week for 2 weeks. That's it. At the end of the 6 visits, if you don't see a change, either they didn't plug the bed in when you got in it, or you have waited too long, perhaps, and it's irreversible. But it's very rare that we find something that we haven't seen some significant change. Now, it might take a lot more than 6 visits, but after 6 visits, you should see some change, whether it's Parkinson's or dementia or Alzheimer's, whether it's any kind of autoimmune disease. We've seen this with rheumatoid arthritis. We had this one lady that she couldn't use the key to get into her home. So she had to rely on her neighbor to help her. Now, this woman was a dancer in her past lives, and she misses all that. She was a professional dancer and a teacher. She couldn't do any of those things, and now she can. And now she could use her own key to get into her house. Did I anticipate that? I don't anticipate anything. Let's just say try it and see what happens. And I get surprised pretty frequently, once or twice a week. Someone's telling me something that we didn't anticipate, like Leber's hereditary optic neuropathy. I didn't know what that was. What it is and what it sounds like multiple sclerosis of the retina. and it's guaranteeing the person's going to go blind. So this one gentleman was going blind. He lost half of his sight by the time we met him. And what we found that the red light did was halt the progression, absolutely stop the progression, and got rid of almost every symptom he had. Headaches and inside, not only regular headaches, but migraines, and then couldn't sleep and some other symptoms. We're not going to probably regain the tissue that's already been destroyed, because multiple sclerosis it's like a cavity eating away at the nervous tissue. So what you want to do is to get in the bed as quickly as you can to halt the progression so that it doesn't get any worse. We had this one lady who, her biggest complaint about her Parkinson's was the severe tremors that she had, so she couldn't hold the Bible when she went to church. And after a week or two of treatment, she was easily able to hold the Bible. She still had some tremors, but they were so much less, she was easily able to hold the Bible. So, I mean, I've got so many different stories. We have Steve that had 40 years of Lyme disease. It ruined he contracted it when he was 12. So it ruined his childhood, ruined his education, it ruined his social life. And of course, it eventually ruined his career. I mean, he didn't have one because his life was a mess. He had no energy. Just sometimes going from the car to his home was a big deal. Getting out of his car and walking to his front door was exhausting for him. And he gets into one of these beds and gets out of the bed after treatment, and he notices no difference at all. So he dismissed it as a bunch of hooey. But 5 hours later, and ever since, it totally changed his life. So I don't have to go into a lot of detail of these, because I'm going to send you a bunch of videos that you can send out as links that they're more, if they'd like to watch. Whether it's somebody that had Charcot-Marie tooth disease, which is a form of autoimmune where the guy is guaranteed everyday pain for 15 years and couldn't walk. And after 6 visits, he was one of the first ones that said this wording to me, that why I started as a hippie to go into chiropractic. He said, "Thank you for giving me my life back." That was what it's all about. That's what I wanted more than ever. And I got that as a chiropractor from time to time, but now we're hearing it pretty regularly with red light therapy. And it's not like, if you're a chiropractor, acupuncturist, any kind of healer, we're not saying don't do those things, but include and incorporate red light therapy into your life, because the kind of results that we're seeing are incredible. I was so jazzed about this. I wrote this book. It's called Illuminated Healing. I don't make a dime out of this book, but if you go to Amazon and look up Illuminated Healing, you can get it as a book. You can get it as a audible, so you can listen to me talk for hours and hours, or you can get it as a Kindle and watch it and read it online stuff. So anyhow, so as you can imagine, I'm very passionate about this. I tell people to just get in the bed. Just get in the bed. Just try it. Well, is it a problem for this or this? Just try the bed for 6 visits. So I want to mention to you a couple of things. One, if you get a chance, anybody that's listening, go to Google Scholar or scholar.google.com. And that'll be in the show notes. I'll send you a bunch of stuff. And you put in the word either photobiomodulation, photo for light, bio for tissue, modulation. It does something. It's the whole action of light making changes into the tissue. Photobiomodulation, and press enter, and you'll see thousands of entries of double-blind studies, articles, and whatnot. If you want to get even more, you can put in the word red light therapy, the phrase red light therapy. And then next to either photobiomodulation or red light therapy, you put in the word lupus, for example, or whatever you're interested in. Because somebody's bound to say, well, is it dangerous for this? Is it okay for that? And in the 50 years that they've studied this technology, there's never been a recorded side effect. And technically, there really isn't any contraindications. In other words, who can't get in the bed? Well, the only one that we tell people, our providers, not to treat are pregnant women. Not because it would be dangerous to the fetus or mother, but if that baby comes out anything other than perfect, they're going to want to blame somebody in that neighborhood. And I suggest, let's not be in that neighborhood. don't get blamed for something that we know had nothing to do with our lights, but you don't want to get involved with that. And it's true of a lot of therapies that we tell people, don't treat pregnant women with that thing until they're not pregnant anymore, and then get that woman in there, especially right after C-section. They're going to recover from that C-section unbelievably. Now, I want to talk to you about how it works, but I also want to mention the word red light therapy and what does that mean and how does it compare to the other infrared and things like that. So when I use the term red light therapy, I am talking about the integration and combination of red and near infrared, not far infrared, near infrared. We're going to talk about how they work in just a minute, but I want to tell you that in this country, by default, typically, when we say the word infrared, we're talking about far infrared. And far infrared, as I said, is just a deep penetrating heat, and it's not going to make any cellular changes like the near infrared does. The near infrared is the miracle wavelength. It makes unbelievable changes to the body. And red's helpful too, but red also is what helps with fat loss. As with many things, they don't know, when it first came out, they didn't know how it worked. Same thing with fat loss also, which I'm going to go over that mechanism as well. So there are two completely separate mechanisms. One's about fat loss, and that's about red light. And one's about everything else, whether it's skin, hair, any organ, gland, tendon, whatever, musculoskeletal issues. Like I said, it sounds like snake oil to some people because it involves and can help just about anything and any tissue in the body. I know it sounds crazy, but what can I tell you? It works. That's all I can tell you, but now I'll tell you how it works. First, we're going to talk about fat loss. This is simple. They didn't know how it worked. It was discovered by accident about 12 years ago, maybe a little bit longer than that, where they noticed that red light could help with shrinking fat cells. But they weren't sure how it worked, but they finally figured it out. So what happens is that exposure to red light on the fat cell will actually create the fat cell wall to become more porous, allowing some of the contents of that fat cell to leak out into the surrounding tissue. And then with a special protocol, we move that stuff via the lymphatic system eventually to the liver for use or elimination. Again, they didn't know why it worked, so they used to think it was about melting fat or whatever. That's not what's happening. Again, we're going to move it away from the fat cell and eventually to the liver. And it works. It's incredible. That doesn't mean the person can go home and pig out and get drunk every night. But if the person has a calorically neutral diet and stays away from the four no's are simple sugars and starchy carbohydrates. When I say stay away, limit them at least. And then sodas and alcohol. Those are the four things. There's many things about health and well-being. I studied nutrition. I've studied weight loss for many, many years. But the four things that are abused most in this country is starchy carbohydrates, simple sugars, sodas, and alcohol. If you could lower that, or if not eliminate those four things, and incorporate a calorically neutral diet. So you don't have to go on a starvation diet. In fact, I don't recommend them, and I'll tell you why. This is not about eating right for a week or a month or 2 months and then going back into your old diet that got you all in trouble in the first place. You want to integrate this into your regular life. It's a change of lifestyle that we recommend, and to try to limit the things that are doing you in. Once my mother became an executive of Weight Watchers, she never ate a good thing again, and none of our family were able to eat a good thing again. But my mother's restrictions were pretty severe. Most people couldn't do that. She never had dessert again from the time that she was, when I was 10. I never saw her have anything that tasted decent, never had dessert. I'm not recommending that. That's there's a certain kind of person that has that kind of personality that can do that. We're recommending integrating a smart diet, a calorically neutral diet with red light, and you'll see great results. So again, the results are not subtle. They actually work pretty decently. So now I'm going to talk to you about a more important, I don't know if the word's important, but the area that I love, and that's how the whole thing works in regards to healing the body. And it comes down to a word that is called mitochondria. Have you heard the word mitochondria?
Yes, of course.
And when you were in school, did you remember that there was one mitochondria in every cell?
Yes.
It's not true. But what they now have learned is that there's so much mitochondria in your body that, for example, the heart, which has the most demand for energy, that the heart has over 5,000 mitochondria for every cell, and that the mitochondria makes up 10% of your body weight. So what does the mitochondria do? Thanks to the mitochondria, it's the reason why you breathe oxygen and eat food, creating this very important molecule called ATP. And that ATP is basically the energy of what your body uses for energy to make a mechanism for anything to work, whether it's healing or energy in general. It's critical. And so what they have since learned is that dysfunctional mitochondria, and there's actually mitochondria dysfunction there's books on it called mitochondria dysfunction and variations of that. And there's actually now a disease called mitochondrial dysfunction. And so if your mitochondria is not doing the job, it's going to eventually lead to illness and eventually to death. And what our job is to reverse that. And that's what our lights do. So let's talk about how this works. In the mitochondria of your body, and there, as I said, it makes up 10% of your body weight. In every one of those mitochondria, in the membrane, is a thing called cytochrome C oxidase. And it is some miracle that we are on a planet with a sun, and the sun can actually stimulate the cytochrome C oxidase to motivate the mitochondria to produce the ATP. So sunlight, mitochondria, ATP production, and cytochrome C oxidase are critical terms for you to understand. When we stimulate via sunlight, stimulate the cytochrome C oxidase, motivates the mitochondria to generate even more ATP, bringing it back to normal, then that person it will lead to a much healthier individual. So what we've done is we've magnified sunlight many times and drive it into the person's body, and with great phenomenal results. Red and near infrared is basically elements of sunlight. Sunlight is made up of many different wavelengths, especially the whole rainbow. And what the research has shown is that it's red, a certain range of red, and certain range of near infrared that can drive this beautiful energy into the person's body. That's what we do. We magnify it many times and drive that into the body. And that's why when a person gets out of these beds, and again, as I said, it's about bathing the whole body at the same time with this glorious energy and bringing the mitochondria back to normal. And that's why it works on anything and everything in the body, because your body is made up of tissue, and every tissue is made up of cells, and every cell has mitochondria in it. And if we can stimulate the mitochondria to come back to normal, then we can have phenomenal success. Well, let me give you a few more things that I want to bring up. I mean, I've got lots, but first of all, as I said, we talked about the book. Another thing that I recommend if you want to learn more about this is go to trifectalight.com. And the reason why we came up with the triple effect of, and we call it a trifecta, has to do with skin, fat, and healing. And that's where the term came up, but we'll talk about that in a moment. But so go to trifectalight.com and you'll see tons of information in there. But also, if you go to the section there about finding a location, you can find a location near you, because that's what you need to do. You need to try this. Then there are two other possibilities. There are some people that have more money than health, and they actually buy one of these very high-end medical grade beds for their home. So I'm 72 years old. I get in the bed 3 times a week. Not that I have an ailment, but I always taught my patients that it's about aging gracefully. And that's what it's about. It's about making sure that you die. Your life is like a candle that burns bright all the ways from the beginning, all the ways to the end, and then sputters out and dies. Not that you spend the last 20 years of your life in a wheelchair and a burden on everybody because you can't feed yourself, you can't wipe yourself, you can't do anything. And it's just helpful if the people take good care of themselves. And I'll tell you why people don't always take care of themselves, because they're not scared enough. So myself as a practitioner, I would have people, I'm going to admit this to you now, I would have patients come in, and to myself, I would think, please God, don't let me wind up like that.
Yeah, sure.
Because these people don't take care of themselves. And the reason is because they were not scared enough. They figured, I'm going to live for today. I don't care about it. I'm living for today. But they don't realize they're actually living also for the future. So what is their 80-year-old self going to say to their 30 or 40-year-old self? And I think what they might sometimes say is, don't do that. Help me out so that when I'm 80, I'm not a cripple. So at any rate, that's, to me, that's what healing's about. And I use the bed 3 times a week, preventatively. But, you'll learn what's best for you, but at least incorporate 6 visits to try it out in the first place. So we talked about the website. I also recommend going to our YouTube channel. There are over 100 videos there about all kinds of information about that I'm talking about. So you go to youtube.com and then put in the word Trifecta Light Official, and you'll see a beautiful series of great videos that are on there. So I recommend that as well. So we talked about the book. We talked about about the website. We talked about YouTube channel, about finding a location near you. When you go to the website, you can just click on there and find a location near you. Whether you were thinking of buying it or just trying it for yourself, you should try it. People go, well, I don't know, try it. And like I said, if you can get 6 visits out of it, that would be the wisest thing. Now, if you feel great and you have no issue, I don't know if you're going to notice a difference. But what we found is that the more severe the person's condition is, the more dramatic the change is, the more amazing the change is. So you can get somebody that has gum disease. When they get in the bed, we have them not wear goggles, keep their eyes closed, and keep their mouth open. So if we talk about the eyes, someone will say, well, is it radiation? Should I have goggles? It's not radiation. It's light. If you can get into a room and turn on the lights to the room, the regular lights to the room, which everyone can, you can get in the bed. That's how dangerous the bed is. In the 50 years this technology has been studied, there's never been a recorded side effect.
How is this not something that people don't know more about? It just seems so obvious.
It's called money.
Yeah, well,
and that's what it's
always
all
the
about.
reason, isn't it?
There's more money in drugs and surgery.
Yeah, absolutely.
So how do you convince somebody who can make tens of thousands of dollars doing the surgery? Listen, the guy that brought this technology to the United States was, as I had said, was a medical doctor out of USC. His name was Chadwick Smith. And he thought all his buddies would join on with him and want to get involved with this wonderful technology, and not a one wanted. They want to do the surgery. Not one of them didn't.
Yeah.
Who doesn't not want to do the surgery? So we had the brother of a very famous icon, like an icon in the entertainment industry. So I'm not mentioning names here, but brother of them, who's also famous unto himself. And he was slated to have low back surgery and shoulder surgery. And I'm being interviewed by a gentleman. His name is Mike Torsha, a great guy. And he's a bodybuilder. If you look his name up, back in the days with the same era as Schwarzenegger, these guys, they look phenomenal, right? So now I meet him, and he's significantly older, well into his 60s. And he looks great, but he's very arthritic and bent over. So when I shook his hand, it was like cardboard. And he's going to interview me on his podcast about red light therapy and all that. But he tells me about his best friend, Frank, who was going to have the shoulder surgery and the back surgery and now doesn't need it. And I'm thinking to myself, well, I hope it's one of our pieces of equipment that helped him. And it turns out it was. It was one of our beds in Beverly Hills. And I hear this all the time. I hear people are going to have surgery or they're going to have this or that. This one lady was getting injections in her eye for her uveitis. Now, normally the pressure in your eyes somewhere between 10 and 12, and her pressure in her eye was 180.
Oh my God.
And
Ouch.
so she needed to take drops and get an injection once. So she took regular drops. The copay for the drops was $400 a month. And the injection in her eye, that cost $5,000 a month, which is covered by insurance. So people don't think about it. But it's, I asked her, I said, well, what's that like, getting an injection in your eye? And she would just mention how horrific it was. So at any rate, there she is getting injections in her eye and the drops. And she's started using red light therapy. And within 2 weeks, she didn't have that problem any longer and has not needed the drops and has not needed this. And her pressure is completely normal now. There's too much money in not doing red light therapy. So that was my long-winded answer to why it is not in every wound center. So you take a wound person who had third-degree burns, guaranteed 6 months of pain, 6 months of drugs, and permanent scarring. By the middle of the second week, the pain was essentially gone. And by the middle to end of the third week, it was gone. So why wouldn't that be in every wound center? Why wouldn't that be in every OR? Because right after surgery, the person's going to heal so much faster if they use red light therapy over it. Because there's more money in drugs and surgery. That's the story. That's the end of it. And I've been facing that for I'm going on 50 years of dealing with this whole thing. And I surrendered a long time ago. What can I do? I can't fight the system. I do the best I can. We help people one person at a time.
Yeah. I mean, if you help people and it's successful, then they tell people, and then they tell people.
Absolutely. Yeah, I just talked to this lady. She just referred 18 people, because she's very influential, I guess, 18 people to an office. We have hundreds of offices all over the country. And she referred 18 people to that one office because she just loved it. And it made such a difference. And that's, we know that satisfied patients don't refer. It's excited patients that refer. And we've never seen so many very excited patients as we have with this red light therapy.
So when you're treating somebody with red light therapy, are there different ways of doing it depending on the condition? Or is this sort of an overall thing that can help kind of everything at the same time? Or is there some fine tuning?
There's some fine tuning, and we didn't always have this capability, but we can pulse the wave. So you have wavelengths, that's the red and near infrared. And then there's frequency, where you're pulsing the wave. And by pulsing the wave, it serves a couple of purposes, but mostly it's about resonating frequency. Some of your people may have heard about resonating frequency. My favorite frequency is 528. So if any of you go to, you have one of these, I have an ALEXA right next to me. So if I say that name, she'll start saying all kinds of words to me. Yeah. But if you said that word, Alexa, and then play 528 healing, 528 hertz healing energy, something like that, and then you put it in a loop, you say in a loop mode, it'll play this glorious 528 frequency throughout your sound system. And it's lovely. So we actually include this echo dot that everyone puts in the room, and it plays this all day long. But there are other frequencies as well, but 528 is my favorite.
I listen to a lot of binaural beats, and that's one of the frequencies, the 528 hertz. There's, there's different frequencies for different parts of the body or emotions or whatever. It's a really fascinating thing that everything is vibration, including light.
And there are several different ways of generating frequency. So you have sound frequency, you have light frequency, you have the microcurrent that you can have frequencies on as well, the PEMF, that kind of thing. Anyhow, I love it. But I will tell you this, I've been working with all these different things. As I had mentioned before, chiropractors love toys. We've had all the toys, and I've never seen the miracle like I have here. So if it was just frequency, it's good. But when you have light frequency and you have light power going through the body. Remember, you want a lot of power without heat. Heat is the absolute enemy. So what makes some beds more expensive and higher grade, medical grade beds is a lot of power that doesn't get hot. Heat is the enemy. What heat does is it dilates blood vessels, drives more fluid to the surface, and that will block the penetration of the light. And that's why we called it cold laser 27 years ago, give or take. It wasn't because it was literally cold, but it was because we didn't want the lights to get hot. And that continues now. But what we could do back then, my entire device back 26 years ago, the entire device was 90 milliwatts. The entire device was 90 milliwatts. Now, each one of our diodes in the bed is set to 3,000 milliwatts. It could go up to 3,000 milliwatts. And there are over 5,000 of them. So just one of them is many times stronger than what I had my whole system. And we have 5,000 of those. So it's thousands and thousands and thousands of times more powerful than what I had back then. So back then it was subtle, the change. And sometimes it was subtle. It was good, but it wasn't as consistent as we have now. Now you'd be hard pressed to find somebody that we couldn't help.
We're talking a lot about physical issues, which is fantastic to be able to help somebody with some of their physical problems or all their physical problems. What about some things like trauma and PTSD and depression and all these other things? And some of them are caused by physical things too, of course.
So I got this email from somebody just recently. She wrote, "If this is how normal people feel every day, I can't believe that I've been missing out all this time." Highly depressed, hated her life, had terrible insomnia and nightmares and all kinds of stuff. And now she doesn't. So we are seeing great results with PTSD. We're making a play to try to get in with the vets because your brain trauma and your whatever kind of emotional trauma will be greatly helped with red light therapy, greatly helped. So the lights can get through the skull, get to the brain, and make wonderful changes there, wonderful positive changes. But it also can control, manage every square inch of your body, musculoskeletal issues, whether it's muscles, tendon, ligament, bone, joints, whatever. Great results with those things.
It's unbelievable what you're telling me.
It is unbelievable. And I admit it. I admit to people that it is crazy.
Wow. It's really, it's helping the body to heal itself is really
exactly.
Yeah. Okay.
That's what chiropractic was always about. You know what chiropractic was about? It's removing the interference and allowing innate to do its job. Yeah. We're ridiculous if we think we can do a better job than our body. Whether you believe in God or evolution, our body knows better. I don't know what the best way of putting this, but we believe in chiropractors know the term innate intelligence.
Yeah.
And we allow the innate intelligence to do its thing by getting rid of the interference. And that's what we're about here. We're getting rid of the interference and we're allowing innate intelligence to take over.
That is the point where you do use the word miracle. If you think the human body is a miracle, which I do, I think it's a miraculous thing. Just hold your hand up and move your fingers around. You know, you can't invent that. That's
unbelievable.
And so when you're doing that, when you're helping that along, that's to me is what a miracle would be. It's not something fantastical from another realm. It's the realm that we're in that we're just have lost touch with, or are not able to access for whatever reason. So this sounds amazing to me. Now I want to try it.
Yeah. Just send me a note where you are, and I'll have my staff find the closest location for you.
I'm in Los Angeles, just like you are. I think you are. Aren't you?
In Los Angeles? Like me. I'm in a better place. No, I'm kidding.
Yeah. Are you in Los Angeles?
I am. Yeah.
Yeah. Because I thought you said that. Yeah. I'm in Santa Monica.
Oh, okay.
Yeah.
We've got a beautiful location in Beverly. We got a couple of great locations in Beverly Hills. We had a location in Santa Monica, but actually near Pacific Palisades, and everything got all screwed up with that. So.
Oh yeah, what a terrible tragedy.
Fires. Oh my God.
That was bad.
But we have that Beverly Hills location that I think you'd get a kick out of meeting the gentleman there. His name is Brett Chilton, and he's a wonderful, wonderful gentleman. When you go to the website, actually, when you go to the YouTube channel, you see a video with Brett Chilton in it. He's very powerful, what he says.
I have something to do after this. I'm going to go to the YouTube channel. So what is I'm sure people would be interested to know, what is the training of the people that are administering this? And it doesn't sound like they need to know much more than what you're going to teach them
Well, I mean, it's best we're dealing with people that know the body. Yeah. Forget about the equipment for a second.
Okay.
It's more important that they know the body. So when the person comes in for the first visit, that they recognize and understand what the needs are, and they can help them better if they know the body. So massage therapists, chiropractor, anyone in natural healing art, nurses, physiotherapists, acupuncturists, people that know the body are what's important. Now, how to use the equipment. So I've had 12 practices, and training associate doctors to do what they have to do as a chiropractor could take 6 months to a year. But to learn how to press the button that says on and get in the bed, 15 minutes to teach them. The setting it's like a calculator. You just go boom, 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 and you got the setting done. They press on and get in the bed.
And is it like a tube kind of a bed? Like you're covered all around?
This thing right here. Can you see it?
Yeah, I can see it. Yeah. Oh, okay. Yeah. It looks like almost like a long tube. It does like a tube kind of.
Well, the reason why
it's got a top and a bottom, like a tanning bed, but with a top on it. Right.
Well, a tanning bed is originally the structure of our bed was a tanning bed years ago, because we weren't sure if it was going to work. So we went to a tanning bed company and said, hey, you're not doing so great with tanning anymore because of the problems they're having. So let's swap out the lights, and we use a tanning bed structure. Mm-hmm. And the difference here, what above and beyond tanning, is that these are unique lights that are, as I said, burn very strong without getting hot. The top canopy comes right down onto the person's body. So it's not a tube. A lot of the tube kind of looking ones, when the canopy comes down, there's quite a distance between the person's body and the lights. Well, as you come away from the lights, you lose power exponentially. So you don't want to have something that's, with ours, it comes flat right onto the person's body.
So
not the weight of it, just it approximates their body. And the hydraulics will allow you to push and pull the canopy to wherever you want it. If the person's highly claustrophobic, we also have a head extension, so they can do it without their head in it. I don't want that.
Yeah.
I want their head in there, but if the choice is not doing it at all, then okay, we'll have the head outside the bed. So we have beds in a lot of athletic facilities. And the NBA has our bed. Olympic Training Center had our bed. We have major athletic facilities. And the reason for athletes to benefit from using the bed is there's two phases to this. It's called performance. And if somebody gets in the bed, they will perform better that day. And then the second phase is recovery, performance. And then they do their thing and recover much better. So I have a gentleman who's now the international champion boxer of his. It's brutal. They're no gloves, so they're knuckle boxing.
Yeah.
And I watched it on Zoom, and it's like, I don't think I even could watch it. But he's the international champion, and he gets in the bed before a bout every day for 2 months, so that it helps with his workout. And then the thing about boxing is, with other sports, you might get injured, you might not get injured. But win or lose, a boxer is going to get injured, period. That's guaranteed. And so all these boxers are using the bed a lot. They get in it before their bouts regularly. And then for them, at least a month after the bout, they'll recover much faster.
I think about boxing and I freak out. I don't like it at all. I don't like the idea of being punched or punching someone.
No, I agree. I've never punched any. Well, the only time I was punched one time was when my older brother punched me in the eye. That was fun.
Yeah, well, that's what older brothers are for. They're supposed to,
That's what I tell my kids. I
and
said,
they,
that's what your brother's for, to drive you crazy.
The people you love the most and they torture you the most when you're kids. That's what it's all about.
That is.
Oh, are we wonderful creatures or what?
So do you have any other questions for me?
I really don't. I mean, I think it's really to my benefit to go to your website and to look at the YouTube channel. I think folks who are listening, that's where the additional information will come.
And I'm going to send you some show notes, so I'll send you a bunch of stuff as well.
Oh, I appreciate that. And best of luck to you. Let's say the name of the YouTube channel and the website again so folks can leave here.
So the website, I don't know if you can read it. It's trifectalight.com.
Okay.
Can you read that there?
Well, I have eye issues, so no.
Get into bed. And so anyhow, so trifecta.
I do see it now. Okay, I see it. Yeah, and it's a triangle, so like a trifecta. Okay.
Right. So trifectalight.com is the website. And if you go to YouTube, put in the word Trifecta Light Official, and you'll get to our official channel, which has over 100 videos. And some of them are spectacular. We have what they call sizzle reels and all kinds of stuff. I get interviewed and have been getting interviewed all over what in the old days would have been all over the country. Now I get interviewed online by all kinds of people from all kinds of countries and walks of life. And so some of those have been translated to beautiful YouTube videos.
I love it. It's so it's really global now. I mean, you said somebody brought it to the United States from USC.
Chadwick Smith.
Yeah, where did they bring it from?
It's the exact opposite. Normally what's happening, and I don't want to generalize, but in general, some of the technology is developed in the United States and it's taken to China to be duplicated and stolen.
Mm-hmm.
But this is the one that was developed in China and brought to the United States. And I'll tell you why countries like Canada and China and Europe would be more prone to using this is because they have socialized medicine. And I'm not going to be commenting on being a socialist. I think capitalism is genius if it's kept in check. But it really probably it shouldn't be in medicine the way it is. So that the guy who's deciding whether you need surgery or not is the same guy that does the surgery and makes 20 grand from that. I'm not sure that's the smartest thing. But regardless, in these countries that are more concerned about people getting better than how much money they can make off of them, something like acupuncture and red light therapy are much bigger there. Well, at least it used to be that way. Now it's really grown a lot in the United States, and it's going to continue to grow. Just what made the difference, as I said, these leaps was, the first leap was fat loss. That was 13 years ago. And the next big leap was the bed, where we learned that by bathing the whole body at the same time, that's when we're going to see these amazing different changes in the body. And you'd be hard pressed to find a condition that we haven't heard great things about.
Well, I'm looking forward to learning even more and trying it out.
Send me your address and I will send you a copy of my book.
Oh, thank you. I appreciate that. I will send it. I have Tom's email, so I'll send it to that.
Yeah, it'll come to me.
Yeah, it's one big happy family over there.
Yeah, of course.
All right.
All right, listen, you take care. It's been a real pleasure. And
thank you.
I hope your whole audience really thinks about looking into red light therapy for their sake.
Well, you convinced me to look into it, so hopefully my audience is of like mind. And they probably are because they listen to the show. So why not?
All right. Take care, kid.
Have a great day. Thank you. Bye.
You too. Bye-bye.
Much appreciation for you folks listening to The Exploding Human. The website is theexplodinghuman.com. There's a YouTube channel where you can listen. That is The Exploding Human with Bob Nickman. Once again, I want to thank Dr. Carl Rothschild for being on the show. And if you want to find out more, go to trifectalight.com and also on YouTube, Trifecta Light Official. Have a fantastic day. Thanks so much.